The House of Reps seem to, think that all your demands will be met, but is appealing. The speaker was appealing to you to at least tarry a while until this government puts structure in place. There are no ministers yet. You don't have people that can take the matter of the doctors. And the last conversation I had with Dr. Oji, he was of the opinion that the doctors don't need to speak to the ministers. Agreements have been reached already. What is left are just implementation. Is that still the position of NARD?
Well, yes, that is still the position of NARD, because if you may recall, as a media officer, some about 7 weeks ago, we released the communique from our emergency meeting.
Okay.
Where some agreements were made with some of the relevant actors of the government, including, or precisely the past government, the Buhari-led government, and some agreements were reached. That agreement is going close to more than 10 weeks to 14 weeks when the agreement was reached. And funny enough, and as God wants it to be, in that meeting where the past administration, where they led that meeting, most of the permanent secretaries, who are the highest holding officers presently as we speak, all of them were there in that meeting, where those memorandum of understanding and all relevant issues were discussed. And the way forward were also spun out. And most of these things, they've passed the level of discussion as at that point. They've passed the level of discussion, we're at level of implementation. Okay, if we take issues one after the other, talking about brain drain, you will also agree with me, if you go to the public hospitals, you will agree with me that waiting time has increased, surgery time has increased. You go to some federal medical centers, teaching hospitals all over the country, you see a doctor managing patients in emergency, you see a doctor with 10, 12 patients waiting for a doctor to see at the same time, and they are all of emergency cases. All these are because of the brain drain. So all this causes patients' deaths, all this causes violence. When you hear of violence in the health sector, you will know that all this brain drain are what is causing them. Because imagine you bring a patient to the hospital and a doctor have not seen your patient for 2 hours, 3 hours in an emergency. But of course, you just have a doctor there, a few nurses there to undo. These are some of the issues we're also pushing for, because we need one-on-one replacement. The bureaucracy in employment has become something else in our health sector. So what we just did is a simple one-on-one replacement, and these were discussed. The mechanism to do one-on-one replacement in that meeting was discussed, communicated to the chief medical directors and medical directors of teaching hospitals and federal medical centers all over the country. And as at that meeting, it was promised that on or before June 5th, the circular will come out. Once that circular comes out, transmitted to the various head of hospitals, one-on-one replacement will kickstart. Up till this minute, we've not had anything. As I said, all the mechanism to make that happen has been set in place. All what they just needed at that point is implementation and for the circular to be out. They promised 5th of June in that memorandum, and up till now, nothing has happened. Going to our Medical Residency Training Act, where it is enshrined that resident doctors will be funded for their training, it's an act, so not a good way. You understand? It's an act from the government.
Indeed.
That's the funding for 2023 has been enshrined also in the budget. So it's not that the government is going to source for fund from somewhere. No, it has been enshrined in the government. So what they just need now is implementation, and signing of that money out of the budget to take care of resident doctors, because going for exams, going for update courses and so on, they are expensive. And also, if you know the current reality of things that are happening now in the country, it makes it more pathetic. When you see resident doctors, they can't even feed their families. We're not talking about going for exams, going for update courses to boost their skills to manage patients properly. So these are some issues. These things have been agreed. These things are there. They are just at implementation phase. So we appreciate the Speaker of House of Assembly, of House of Reps, which he has, of House of Rep, he has come in to discuss with our national leadership. Our national leadership, of course, we'll have a meeting this week. All those will be discussed at our meeting this week. And we hope that a positive conclusion will come out of it.
So is it impossible to go on strike and get things sorted before you call off the strike?
Okay, when we go on strike, just I know you understand that aspect also, that doctors on our part, or healthcare workers, going on strike is the last thing we want to play on for. And our patients are very important to us. But by the time you see us going on strike, you should know that we've dialogued and we've gotten to the breaking points. Only this year, we've given ultimatum about 3 times to the government, bringing these issues, which you and I agree they are germane issues. Presently, most doctors, they trek to work. And you understand the frustration that people go through to deliver healthcare to Nigerians. You will also agree with me that there are so many state governments that you have seen, because of the hardship, which they have recognized that there's hardship in the system right now. They resorted to 2-day weekly working system, 3-day weekly working system. But the hospital services, can you do that? Can you do 2-day working system in the hospital services? So you see that the weight is now still falling on the healthcare system, the healthcare workers. We still go to work every day, even with the hardship that we're facing. As I said, doctors, people have packed their vehicles and they trek to work every day. They walk to their hospitals, and you imagine the frustration that people go through to deliver healthcare services to Nigerians. And when you talk about strike, can you leave the doctors or leave us from this discussion and focus on the government, so that you have seen our plight, you have seen that their germane plight, you have seen that we want the good for you and I. So why your question should be on the reverse, because we are going on strike, pressing our needs for everybody to be comfortable. Are we also on our part? Are we going to solve those problems? We're not going to solve those problems. It's the government that is supposed to solve those problems for us. Which the government on their side, they know, and they've accepted on different meetings that these issues are issues that are germane. And most of them are things that can be done in hours to days. Because as I told you earlier in our discourse, I've told you that these things are just at the level of approval. Most of the machineries and the mechanism have already been put in place to make them work. So it's just for 1 or 2 signatures, 1 or 2 things to be appended, and these things will come to fore, and people will be happy, people will be comfortable. That is what we want. So we expect, and we are crying to the government at this point to listen to us, because we don't want to go on strike. But if you push us to the wall, people are tired.